KPLC is connecting you with Home Healthcare 2000, and they are celebrating their nurses this week, and we want to thank all of the nurses for doing the wonderful job that they do. They've got a tremendous nursing staff here that go in and help people in their own homes, and today we're talking with the Director of Nursing, Tricia Smith, an RN here with Home Healthcare 2000. And we wanted to let people know how the process even starts if you think that you could use home health in your own home. And the first thing is you need to talk to your doctor. What do we need to ask them? What do we need to tell them is going on?
When you call the physician, you want to tell them what symptoms mom or dad has been exhibiting that may require the needs of a skilled nurse, or physical therapy, occupational therapy, speech therapy. And then from there, your physician will write the order and contact the home health agency.
All right, and you do have the right to choose the home health agency that you're inviting into your own home, because that's a really important choice to make, because they're the one that's going to be coming in regularly and taking care of your loved one.
Right.
All right, well, Home Healthcare 2000 does a really thorough assessment when they come into the home for that first visit. What's that assessment all about, and what are you looking for?
Okay, well, basically, because we're the eyes and ears of the physician, we go into the home and we do a head-to-toe assessment. We assess the patient's medications. We assess the patient's ability to care for themselves. We also assess the home environment for safety. We assess if there's a caregiver in the home, is the caregiver able to care for the patient?
Because you even go to the extremes, I guess, or of teaching the home health person or the caregiver in the home how to do some of the work that they need to do to keep that person healthy and at home.
Right.
All right. When we're talking about people that need home health care, we're looking at people that have chronic illnesses, things like diabetes and other chronic illnesses, right? Illnesses, injuries, falls, surgeries, and the goal is really to keep them out of the hospital.
Right.
All right. So what types of things do you do when you go in? Are you going in once a week? Are you going in every day? Or does it just depend on the patient?
It all depends on the assessment of the patient. When we go into the home, like I said before, we do the assessment, and then we also, we may do medication management. We do a lot of teaching, whether it's teaching to the patient or the caregiver, as to how to help the patient manage their own disease process.
All right. It really is a lot of learning for everyone involved, and of course the end goal is to keeping that patient, your loved one, at home and healthy and thriving. And it's nice to have the eyes and ears of the doctor able to come in so that you're not always having to go to the doctor regularly and keep making those doctor's visits. You can do all of that from the comfort of your own home. Well, if you'd like to find out more, just give them a call. Home Healthcare 2000. They'd be happy to give you more information over the phone. You can find out about how you can get services set up for your loved one.